Welcome to today's lecture on the intricate and fascinating subject of lung metastases. In this comprehensive script, we will delve into the mechanisms, molecular pathways, diagnostic techniques, and various treatment modalities associated with lung metastases. By the end of this lecture, you will have a deep understanding of this complex topic and be equipped with the knowledge to make informed decisions in clinical practice. Tumor cell dissemination is a multifaceted process involving several biological mechanisms. Intravasation, the first step, refers to the entry of cancer cells into blood or lymphatic vessels from the primary tumor. Subsequently, these cells travel through the circulation to reach distant sites, such as the lungs. Next, extravasation occurs, where tumor cells adhere to the endothelium and extravasate into the surrounding tissue. Finally, colonization takes place, wherein cancer cells establish secondary tumors in the lung parenchyma. Understanding these steps is crucial for developing targeted therapies that disrupt the dissemination process and prevent lung metastases. The development and progression of lung metastases are driven by intricate molecular signaling pathways and genetic alterations within cancer cells. Key factors involved in tumor cell adhesion, migration, and survival include various growth factors, adhesion molecules, and matrix metalloproteinases. By unveiling these pathways, researchers can identify potential targets for pharmacological interventions and therapeutics aimed at preventing or treating lung metastases. Accurate and timely detection of pulmonary metastases is vital for effective treatment planning. Numerous imaging modalities, including high-resolution computed tomography, HRCT, positron emission tomography, PET, and magnetic resonance imaging, MRI, play a crucial role in diagnosing and characterizing lung metastases. We will explore the principles behind these imaging techniques, their strengths, weaknesses, and their applications in clinical practice. Surgical resection of solitary pulmonary metastases offers the potential for long-term survival. We will analyze the indications, techniques, and outcomes of surgical interventions for lung metastases, including minimally invasive approaches. Additionally, we will discuss the impact of patient selection criteria on surgical decision-making and explore the advancements in this field. Radiation therapy plays a significant role in managing limited metastatic disease in the lungs, especially in cases where surgery may not be feasible or appropriate. We will review the principles of radiation therapy and focus on the use of stereotactic body radiation therapy, SBRT, and the potential benefits of ablative treatment in lung metastases. Chemotherapy remains a cornerstone of treatment for advanced lung metastases. We will discuss the principles of chemotherapy and explore the most commonly used systemic treatment regimens. Emphasis will be given to combination therapy, dose intensity strategies, and the importance of tailoring treatments based on primary tumor histology. Targeted therapies, such as tyrosine kinase inhibitors, TKIs, monoclonal antibodies, and immune checkpoint inhibitors, have revolutionized the management of lung metastases. We will explore the emerging role of these therapies, focusing on the underlying molecular biomarkers and predictive factors that guide treatment decisions. Immunotherapy has emerged as a groundbreaking approach for treating metastatic lung cancer, offering durable responses and better survival outcomes. We will investigate recent advances in immunotherapy, including immune checkpoint blockade and adoptive cell therapy. Additionally, we will analyze the mechanisms of action, clinical efficacy, and associated toxicities of these treatments. Surgical resection, known as metastasectomy, has proven beneficial in selected cases of lung metastases. We will evaluate the role of pulmonary metastasectomy in the overall treatment plan, examining prognostic factors, patient selection criteria, and long-term survival outcomes. This information will aid in decision-making regarding surgical interventions in the treatment of lung metastases. Molecular profiling of lung metastases using advanced techniques like next-generation sequencing, NGS, and gene expression profiling holds great promise in guiding treatment decisions. We will discuss the utility of these profiling methods in identifying potential therapeutic targets and resistance mechanisms, enabling a personalized approach to treatment. Metastatic lung disease often presents with various pulmonary complications, including pleural effusion, pulmonary embolism, and bronchial obstruction. We will review the optimal diagnostic and therapeutic approaches for managing these complications, focusing on improving patient outcomes and quality of life. Innovative and experimental approaches in the treatment of lung metastases hold promise for the future. Combining therapies, novel targeted agents, gene therapies, and immunomodulatory agents are all areas of ongoing research. We will explore the preclinical and early clinical trial data, shedding light on the potential of these approaches. Lung metastases pose a significant challenge in clinical practice. However, through a multidisciplinary approach and a deep understanding of the mechanisms, molecular pathways, diagnostic techniques, and treatment modalities associated with lung metastases, we can improve patient outcomes. The comprehensive knowledge gained in this lecture will equip you with the tools necessary for making informed treatment decisions and contributing to future advancements in this field. Thank you for joining me in this enlightening journey through the complexities of lung metastases.